probably one of the least known procedures, at least in North Texas, is the Brazilian butt lift. Why is this procedure done so sparsely here in North Texas?
Well, it is done a whole lot more in Florida and Miami. That's the kind of trend there to do it, and there are surgeons there that have been doing it for a while. So basically, it is taking fat from other areas, putting it in the buttock. And so there's two components to it. You take the fat from, say, the upper back, the thighs, the flanks. That all accentuates the buttock. Instead of then throwing away that fat, you filter it and inject it into the buttock.
Is it dangerous in any way?
Well, so the process of taking the fat out is just liposuction. It's just like what I do for everybody else. And then we do safeguards so that the fat is placed in a way that it's safe, so it does not get in the bloodstream, so it doesn't cause problems with embolus is what it's called. There are certain things that you can do to make sure that that doesn't happen. So the fat is placed almost in the way that we do a breast augmentation. You want to accentuate what the patient has. But the same idea of putting a breast implant, which is basically what was done before we figured this out, in the buttock area, buttock implant, didn't work very well because you sit on your rear end. It displaces it. They had problems with the implant moving, them being asymmetric. When you put the fat in, guess what? It's your fat. It grows there. It lives there. Not all the fat that you put in takes, maybe 50% of it does. So I do probably as many as anybody in North Texas. I really enjoy doing it. It's a very fun procedure to do, and it works very well.
Why are there so many misconceptions about the Brazilian butt lift?
So there are some people that think it's actually a lift, meaning that you cut above the buttock. That's only done in patients who have lost lots of weight, and then that's a much more involved procedure. With this, you don't make big incisions. Patients that do this don't want to have a big incision above their buttock. You're taking what they have and augmenting it with their own fat, which works very, very well. That fat then lives there and stays just like it was meant to be there.
And what is the visual benefit of this procedure? You've talked for years about the benefit of Sculptra and Sculpture, the way that tablecloth works on the face. What's the example that you can provide for this procedure in terms of how it helps make the body look more athletic and younger?
It shapes it. So when you're doing the procedure, you're shaping the flank area, the hips, transitioning into the buttock, which with time flattens. So this gives more projection to the buttock. It gives that curve back to it. So what you're doing is treating above the buttock and below it, and then putting fat in it to then make it look it's very curved. It's very sexy. It's a very nice look. And really, there's nothing else that will do that so well as what the misconception is with the Brazilian butt lift is that there's an actual lift. That there's not.
Not one. And finally, what is the downtime for this procedure?
It's like with liposuction. And so there's also misconceptions about not being able to sit. I let patients sit immediately. I don't think that has anything to do with the take of the fat. I don't think that has anything to do with the positioning of the fat. Wherever I put the fat, it stays. So basically the recovery is you're sore, and then your rear end is sore for a while. But 2 to 3 weeks, the soreness starts to get better. Then they can go back to exercising, because people who do these procedures, they want to exercise. They want to maximize their appearance. Well, we're doing something that they can't do with diet and exercise. I'm maximizing what they have through surgery.
Is this primarily a procedure that women use, or are men using it as well?
It is women. It's to accentuate the female, the buttock area in a way like nothing else can.